our next speaker is Professor David Gozal. He is the Marie M. and Harry L. Smith Endowed Chair of Child Health at the University of Missouri School of Medicine. He's a pioneer in the study of childhood sleep problems and the relationships between sleep disorders and neurobehavioral, cardiovascular, and metabolic disease. Today, he'll be talking about sleep and unstable ecosystems.
Well, good afternoon, everybody. So two things. One, the planning of these lectures was extraordinarily powerful because it represents the optimum time for a nap. So if you decide to nap, you will learn the best from everything that you've learned today. So don't hesitate, go and take a power nap and disregard my talk. You won't learn anything from it. Second, I really applaud the opportunity of bringing a little bit of sleep into a context where sleep and climate change don't seem to be interrelated. And so I congratulate Dr. Cornfield and the organizing committee, one, for the extraordinary choice and wise choice that they made, and second, of course, for inviting me. Obviously, I'm here and I love to be here in Stanford. So my time, well, I don't have any conflicts of interest. All I have is grants from the NIH, and those are difficult to come. And so I'm not going to say that I have a conflict with those. I would like to, first of all, talk a little bit about what do we consider sleep health. It's a concept that all of us will take for granted, but we have learned over the last several decades, and certainly a lot of the work has been done here at Stanford by Bill Dement and all this group, and I'm sure that many of you know of the fantastic group that you have here. But there are important elements. First, the concept of sleep quality, both at the level of macro, but also at the level of microarchitecture, with very sophisticated analytics of both the EEG and everything else that leads to understanding how deeply rooted sleep is. We sleep a third of our lives. And as Alan Rechtshafen, when I was at the University of Chicago, told many times, if sleep did not fulfill a vital function, then it was the biggest evolutionary mistake that we ever made. So sleep is important. And quality of sleep obviously affects everything that we do. Second is the duration. If you don't sleep enough, then there are going to be consequences. And all of us have a very significantly different heterogeneity of regulatory components that leads to our ideal sleep duration. So it's important that if you sleep, oh, I sleep 7 hours, oh, I sleep 8 hours. Well, if you sleep what you need to sleep, then you will sleep exactly what is good for you. And I don't care whether it's 6 or 7 or 8, as long as you have the exact amount that is good for you homeostatically in order to preserve your stability and function. Third, we need to sleep regularly. Irregularity of sleep, even if you sleep, this total amount, total on average is the same, just sleeping irregularly is going to cause problems. So, well, I didn't sleep a lot during the week, but now I'm going to catch up on my sleep during the weekend. Sounds great. It does fix a little bit, but it's not sufficient. So I want you to understand that these are all elements that when we start analyzing the impact of climate change or anything else on sleep, we need to take these specific dimensions into context so that we all talk the same language. Fourth, it depends on where you sleep. If you sleep on a chair and does this, or sleep in a wonderful bed with every luxury and satin sheets, I mean, come on, we all know which one we would prefer. So sleep settings are important. I don't recommend that you go on a tree and sleep there. So particularly when you enter REM, you might fall. And then finally, what's the environment, the temperature, the conditions, the anything else that could affect the quality of where you sleep? Could all of these affect in general, the quality and the ultimate quality of your sleep? So the first thing that I wanted to point is one that we haven't talked about, is noise. And noise pollution is terrible. Noise pollution is everywhere. We are contaminated by noise pollution, and I think that that's an element that is part and parcel of our lives, and yet we don't take it very seriously. And so I wanted to just point out one of many, many studies, but one that where if you live in a high noise versus low noise elements, you're going to see already impacts on the bedtimes, particularly during weeknights, but also during weekend nights for adolescents. Now, we all know the problem of sleep with adolescents. Take an ad that you live next to an airport or next to a train station or next to a freeway, and now you're going to have a compounded effect of all the electronics, all the light pollution, everything else, and now noise pollution to add to this. And so, for example, when we did a very subset, I won't present the data, it will be published soon, but when we did an analysis of the depression rates during COVID among teenagers and children that lived in very noisy environments compared to those that lived in less noisy environments, we found also a significant effect when we adjusted for everything else, for depression. So these are elements that we need to take into consideration that are important. The European Environmental Agency has actually done a very interesting statement. 1 million healthy years of life are lost every year due to health effects of environmental noise, including annoyance. In other words, you behave very annoyingly, sleep disturbance, and ischemic heart disease. So these are the three major consequences of environmental noise on our systems. Now, I would love to take a look at how our statistics of all the other ill effects on the lung or anything else, on asthma and so forth, would take if we take into consideration environmental noise as another compounding effect of the environment into our lives. And so this is an editorial that was written in 2014 that already advanced the proposition that nocturnal environmental noise provokes measurable biological stress responses, and that it clearly affects sleep architecture and subjective sleep quality. There are very few good studies about this, so this is an opportunity to then delve a little bit more. And the consequences clearly, and because they're so similar to those that I will show later on, about cognition, mood, and of course, cardiometabolic health, all the chronic diseases of our civilized society, quote unquote, civilized. Now, I will go back to the biology because this is the fly. This is a fly body. And you see that on here, I won't get into all the details. This is not what I do for research, even though I work on animal models. These are all the temperature-sensitive channels in the Drosophila. And you can see the homology that exists with mammals. And we are very sensitive. In order to regulate our sleep and our energy, we are very sensitive to temperature. So temperature is a major driver to regulate sleep function as a whole. And if you warm the brain, particularly certain regions of the brain that are very loaded with a lot more of these channels, you're going to stimulate a sense of sleep, but the quality of sleep is not going to be very good. In contrast, if you reduce the temperature, you're going to stimulate wakefulness, but at the same time, when you sleep, you actually will sleep very well. But those, when the external temperatures are instead of internal temperatures, everything changes exactly the opposite way. So there is a disproportion between the external temperature and the internal temperature in both ectothermic and homeothermic animals in order to regulate sleep, as sleep being the driver, the ultimate goal. And that is kind of, we tend to forget how important sleep is, okay? So the first study that I'd like to present is one that was done by Pablo, who was a fellow with our group. And is from Chile. And so this was a unique opportunity. If you recall the geography of Chile, it's a very nice spaghetti all the way from the north to the south. So we could actually ask a very simple question by taking adolescents and say, hey guys, how do you sleep? And how much time do you sleep based on the latitude, okay? And what we found, which is what we expected to see, was that as you go further south, in this case, for us, it would be the other way. If we go further north, as the temperatures go down, you actually sleep longer and deeper. I told you the effects of temperature on the outside will actually want you to cozy up and pull your nice satin beds with the very nice covers and be so good. Okay, so that actually will promote longer sleep over both during weekdays and weekends. And this was, by the way, a very constant feature that we saw at almost every age. But in this case, this was a population base, and we did it both for adolescents as well. Now, so what happens when you change the climate? And this is, I think, probably the best study, and I really would advise you to all of you to read it. There are 2 papers that I will present. These are the only 2 papers that exist, so there's not a lot of literature. If you wanted to find a lot of literature about temperature and climate and sleep, there's none. Okay, so this is a great field to open. You want to be a pioneer, this is it. So what these authors did was really, really nice, was to take nighttime temperatures based on data reports and then survey on the basis of geographical reported temperatures, and then look at derivatives of outliers from this based on higher temperatures, and therefore anomalies, and look at human sleep loss in 765,000 respondents from the period of 2002 to 2011. And you can see a very clear thing. The mean monthly nighttime temperatures, anomalies, okay, the more there were, the more there was a possibility of having short sleep nights. So the more you have a climate that changes towards these outlying events of having higher temperatures, we talked about death. Well, I would argue that the cumulative elements of death may be related because during sleep we have autonomic nervous system features, and then vulnerable individuals who may have cardiovascular disease or any other type of disease will actually suffer from that period of vulnerability and die during their sleep or immediately after their early morning during the very high temperatures in which now their systems are being treated. Needs to be tested, but I would love to take the advantage of seeing this analyzed in a little bit better and introduce sleep into the context of understanding death, for example, from outlying high temperatures. Now, what they also did was to then analyze this in a little bit more of a coordinated geographical element. And, oops, sorry about that. Oh, of course, no, okay. So what you look here is at the density of events that occur as opposed to nightly temperatures of if you were to do a prediction, a logistic prediction over time. And you can see that the number of events of outlying temperatures or anomalies will continue increasing. And as it increases, the predicted number of nights that you have short sleep or poor sleep is going to increase proportionately. So we are up for an epidemic of insomniacs. Now, we thought that already we were loaded with insomnia. Welcome. If anybody wants to bet on a good job, let's come to sleep medicine. That's my motto here. That's exactly what I'm trying to tell. And it's the same forecast here, just looking at how this would show up if you were to look at it more quantitative, or as a map if you were to look at it at the distribution in the United States. Now, the other second paper that I told you is published in One Earth in 2022. It's a great group from Denmark. Nico Bradovic is a spectacular scientist. And what it shows is exactly the same. So for a change, 2 papers that have analyzed data coming from 2 different sources essentially find the same result. So if 2 papers agree, there must be something true about them, okay? Because most of the time we tend to disagree with each other in science. So what you see here is the same, that as the mean nighttime temperature derivatives go up, then the total amount of sleep is going to decline. So second time that you find the same, and again, as the nighttime temperature in centigrades goes up, you can see that the percent of nights that will take place, shorter sleep will take place, okay? So this is really a very consistent finding. and one that I think should preoccupy all of us as we go into a higher number or higher proportion of high elevated temperatures. This is very likely to happen with what are the consequences? And so these are the consequences. And the first thing that I wanted to point out is that we are differentially susceptible. Okay, so females are more affected than males. Lower income is much more effectively affected than higher income, maybe because we have access to air conditioning, maybe because we are better insulated houses, maybe because of a lot of other factors that obviously cannot be analyzed. But nonetheless, the point is that if you are in a lower income setting where the residential elements are less protective, maybe that is going to impose yet another burden on shorter sleep. And the third element is age. Older age is clearly a very important one, okay? And you all, in every heat wave that you see, you hear about the deaths and about the older people dying because they have little access or whatever. I would surmise that in addition to this, these individuals are sleeping much less, and again, bringing to the issue of heat as a fatal cause for many people. So we need to start thinking in those terms of inequalities that exist in the context of climate change that affect sleep, and downstream from sleep have tremendous adverse consequences to our health as a whole and specific elements of our health in particular. And so this is really, if you were to look at the RCP 8.5 by 2050 or 2090, estimates and predictions, and these are just conservative estimates, you can see that shorter sleep will start emerging in very, very significantly around the world. And this is further worse, as you would expect, and shorter sleep will really take a toll if we were to look for the current estimates that are pessimistic. So it's not that we're trying to play here to, oh, well, sleep is going to be worse or better and be alarmist. I think that this is not a call to action, but more of what are we going to do and not sleep over it, right? No pun intended. So a systematic review has been done of the literature about climate change and sleep. That's the only systematic review that was done. See, that I had an easy task. I didn't have to really go over a lot of, thank you, Dr. Cornfield, for making such an easy task for me. 16 studies total met inclusion criteria. 6 studies were related to the effect of rising temperature. 7 studies were related to extreme weather events with all the stress that associates with it and the impact that it has on sleep. And then 3 studies were associated with either floods or wildfires. So not a lot of things to do. And all of those, we found diminished total sleep times and sleep disruptions were particularly in vulnerable populations, including the elderly, and lower income. So all of these affect elderly and older income, but the body of evidence was clearly limited. And so this is kind of a construct of, if you want, of how we should look at this. And the rising average and extreme temperature will change its precipitation, and extreme weather events and floods and droughts and wildfires, of course, are going to happen. And around all this, this is what you're going to start reporting is increased sleep-related breathing disorders, pollen, allergies, and so on, also affecting the upper airway. The pollen doesn't go to the lung without going through the upper airway first. So in children, particularly those with an allergic condition, you're going to see enlarged tonsils and enlarged adenoids that are going to lead to a much higher frequency of sleep apnea in those populations. We see that there's a huge overlap of sleep apnea and asthma, with moderate to severe asthmatics, 60 to 70% of those having sleep apnea. So that those with multiple study, one after the other, repeating the same findings. So I would surmise that in children, the probability of changes in pollen and changes in asthma and changes in allergies are going to translate also in an escalation of sleep disorder breathing with all the consequences that are attendant to this. And insomnia on the other side, right? So disrupted sleep with either parasomnias that affect children or insomnia that affects older people, etc. All of it leading to insufficient or inadequate sleep, and then ultimately with all the consequences that go with insufficient or poor quality sleep. And so there was an editorial that I invited as one of the editors of the journal of sleep medicine in the Sleep Research Society. And Chandra Jackson really did a spectacular work with her colleagues and pointing out 5 elements that I think are very important. Environmental rising temperatures with shorter sleep time and poor sleep quality. You've heard a little bit of that. Associations between hurricanes and subjective poor sleep post-disaster. That too can impose a substantial, at least maybe temporary, but certainly with PTSD associated with many of these. If you go to New Orleans after Hurricane Katrina, there has been a huge rise in the frequency of insomnia associated with a single event that was very, very detrimental to the city. Sleep disruption as indicated with floods or wildfires, shorter sleep duration, insomnia, and poor sleep quality with earthquake survivors, and then linkages between flood-related hardship during pregnancy and sleep problems at age 2 years in the offspring. And this is the first and only study. There's only one study. It's not good quality, but nonetheless, it was the only thing that they could do. The mechanisms of epigenetics associated into children or offsprings born when any events, wildfires, hurricanes or typhoons affecting pregnancy, those clearly need to be studied in order to see what are the overall methylation elements at CPG islands that take place and in what genes in order to understand better what the downstream effects could be. So the important message, though, is that children, even though the studies have not focused on children, children are particularly vulnerable to the health impacts of climate-related, first of all, because they have limited autonomy to protect themselves from the causes of climate change. Second, they have distinct health behaviors. They play more outside than we do. And if they do, even though now by the rate that they use their iPhones or smartphones, maybe that's not the case. But nonetheless, if ideally they were to play outside, they're going to be exposed to much higher levels of pollution, of ozone, of all the pollutants, etc. And that could be. They have rapid rates of growth and critical developmental periods where related events could have a much greater effect. And they, obviously, as already illustrated early, they are consuming much more per unit of weight than anything else, including oxygen and air and everything else. And so then they also have many future years. And so the long-term takeoff of their events can take place they have more time to develop the consequences than we do. So for all those reasons, I think that we clearly should put children as a priority in any conversation related to climate change, particularly as far as I'm concerned, children need more sleep than anybody else. And because of that, their quality of sleep should be protected for their own welfare for the long term until they become adults. And so this is a very nice model that was put together as a proposed model by Dr. Jackson. And this conceptual framework, I think, really applies when we need to start thinking here at the beginning of life and how many elements can actually apply to them. So I'm going to summarize that there is, first of all, a paucity, not to say poverty, of data related to the effect of climate change and associated ecosystems in sleep. It is very likely that based on current trends with increasing temperatures, shorter sleep will start occurring, natural disasters will foster stress responses and insomnia, and cumulatively will result in very adverse effects on mental and cardiometabolic health. Children, older people, and economically challenged populations are particularly at risk, and as such, all of us need to advocate for sleep equity and conduct the necessary studies to generate the clinical evidence that is necessary to enable the policies that will protect these populations and the dire consequences of climate change. So for that, I thank you for your attention, and I will end up here.